Hi, I'm Dr. Hilary Lampers, a naturopathic physician. I'm also a neurocranial restructuring specialist. You may be wondering what that is, and I'm going to share a little bit about what I do and the power of this treatment. I do a treatment called neurocranial restructuring, NCR for short, and it's actually an old chiropractic treatment that was developed from osteopathy in the early 1900s. It is a very powerful modality for actually changing the entire structure of your head and face to determine the health of your nervous system. So everybody gets a little like, what does that mean? What does that mean? Let me just explain it in the simplest terms that I can. If you think of your body as in engineering is like you build a building, right? And you put the roof on the building, you have the frame of the building, and you have the foundation of the building. If you look at a body, we are much built like that. We have our skeletal system, we have our muscular system, and then we have our nervous system. And they all three are working together continuously to keep you upright and your eyes on the horizon and your balance organs working. And so the head is a very important piece of this engineered structure because it holds the brain. And the brain in the body is one of the most important organs. So your body's job is to keep you upright, keep you walking, keep you from being dizzy, etc., so that you don't fall over and hurt your brain. As we know, a lot of people, from the moment they start walking, they're falling over and hitting their head, sometimes injuring their brain. We all grow up playing sports and jumping off of things, and then maybe playing football in high school and college, or being in motor vehicle accidents. The chances that you've had some sort of head trauma is probably pretty high. Statistics show that over 2 million people a year have some sort of traumatic brain injury, whether that's a mild concussion to a brain injury that causes death, but it's a pretty common thing. So when you hit your head, it creates a whole ripple effect down the whole body and how it affects your structure. So when you hit your head, it changes the shape of the bones. And when the bones change shape, it changes the connective tissue inside the bones. That then changes the way your cerebral spinal fluid is pumped around your brain and up and down your spinal cord. It changes the placement of your head, which therefore changes the way your spine curves and your pelvis sits, and your knees maybe knock or they don't, the way your arches are on your feet. So the treatment that I do, neurocranial restructuring, is actually a cranial manipulation where we manipulate a bone in your head that's attached to it's attached to 19 bones in your head. So you have 22 bones in your head. That bone, the sphenoid bone, is attached to 19 of those bones. And so by adjusting that bone, we're able to get kind of a global change in cranial shape, in neurological function, and in cerebral spinal fluid flow. The groups that I mainly work with are headache. Like myself, I had this treatment in my early 20s to help my headaches, which it did, and that's why I'm here. So I see a lot of headache. I see a lot of injury, so whether it's from a car accident, a fall, etc., and head traumas. I'm a big advocate of taking care of your head. And then chronic breathing problems. So part of the dynamic of the head and face and the structures of the skull is breathing through your nose. And a lot of people cannot breathe efficiently through their nose. This is why sinus surgeries and nasal surgeries are some of the biggest surgeries on the planet, because a lot of people cannot breathe effectively through the nose. So this treatment can actually change the dynamic in there without having to get surgery, so that you can breathe better and fight conditions like chronic sinusitis, sinus pressure, sinus headaches, chronic ear infections, and poor drainage of the head. So those are the three biggest groups that I see. But I also love to see healthy people who are just looking to improve their being. And this treatment can really do that because, like I said, from the moment we start weight bearing, you have falls and dings and dents and etc. And so this type of treatment can help put you back together and just make you feel more aligned and help your brain function better. So Neurocranial restructuring is a really powerful naturopathic modality that can help you with pain, breathing, and overall neurological function.